and I want to welcome you all to a very special presentation in recognition of Tick-Borne Disease Awareness Month. I don't know if anybody knew that, but May is Tick-Borne Disease Awareness Month. And this is our third year presenting this very informative, very important panel discussion with our distinguished guests, which I will announce and introduce shortly. Before I start, I'd like to just say thank you to Jane Health, SOFO's Advisory Council member, for spearheading and stimulating us to do this 3 years ago. So Jane, thank you so much for doing this. And Jane also underwrote and sponsored a lot of the goods that you see here today, the refreshments, so thank you, Jane. I also want to thank Shellfish Oyster Company, Barley Dunn and his family, for being here and providing their delicious oysters for this event. So thank you, Barley, for being here. And then I'd like to just say thank you for being here. It's very, very important panel discussion. This is being videotaped, so if you have any friends or family that couldn't make it today, this will be videotaped and will be available to be viewed in the near future. So with that, I'd like to introduce you to our distinguished panel speakers. To my left, Luis Marcos. I'm sorry, I have to read this.
I'm here.
So Luis Marcos, thank you for being here. And I'll just read a little bio about Dr. Marcos. Dr. Marcos is an associate professor of medicine and director of the Infectious Disease Fellowship Program at Stony Brook Medicine. He received his medical degree from the Universidad Peruano Cayetano Heredia in Lima, Peru, one of Latin America's top medical research institutions in the field of tropical medicine. In 2015, Dr. Marcos arrived at Stony Brook Medicine, where he now sees patients as attending infectious diseases. Currently, Dr. Marcos is the principal investigator of a clinical trial on Lyme disease and babesia. Dr. Marcos is an active member of the medical advisory panel of the Regional Tick-Borne Disease Resource Center at Stony Brook Southampton Hospital. Thank you, Dr. Marcos, for being here today. Jerry Simons. Jerry's appeared here before several years ago and last year as well. So Jerry Simons is a clinical assistant professor at Stony Brook School of Health Professions. He graduated from Stony Brook University with a degree in cardiorespiratory sciences and went on to graduate from Cornell Medical College's Physician Assistant Program. In addition to teaching at Cornell and Stony Brook for over 20 years, he has been practicing as a PA here on the East End since 1995, where he has treated tick-borne diseases of all types. He is currently conducting national study through Stony Brook to look at the connection between Lyme disease and fatigue. Jerry has been a member of the medical advisory panel to the Regional Tick-Borne Disease Resource Center since its inception in 2014. Thank you, Jerry Simons, for being here. Rebecca Young. Nurse Rebecca Young has been the patient navigator managing the helpline for the Regional Tick-Borne Disease Resource Center at Stony Brook Southampton Hospital since 2015. Rebecca is an active student of Lyme and tick disease, having participated in numerous international conferences of the Internal Lyme and Associated Diseases Society. In any given year, Rebecca will speak to between 500 and 900 residents and visitors. In addition to answering calls to the helpline, she's an active lecturer on tick disease in libraries, clubs, and civil groups throughout the East End. Rebecca Young, thank you so much for being here today. Paula Montagna. Paula Montagna is the Director of Clinical Nutrition at Stony Brook Southampton Hospital, where she manages the clinical nutrition team, promoting nutritional wellness for patients, staff, and visitors. Paula is a registered dietitian with over 30 years of experience. For the past 10 years, Paula's focus has been on integrative and functional medicine and culinary nutrition, lecturing extensively on food as medicine for physicians, clients, and the public. Paula's lecture, Nutritional Strategies for Lyme Disease, stresses that an anti-inflammatory style diet that emphasizes fresh vegetables and fruits and high in antioxidants, healthy fats, fiber-rich whole grains, and lean proteins will tame inflammation and optimize recovery from Lyme disease. Thank you, Paula, for being here. Thank you very much. So with that said, I just want to mention a few things. We would like to just keep our presentations to about 20 to 30 minutes for each presenter. I understand some of you have PowerPoint presentations. I think we all did a little test before we started, and I think we're good to go. So with that, I also want to mention to the audience that we just hold our questions till after each presenter has concluded their presentation. I believe there might be handout pads that were handed out for people to write questions down so that they can be asked after the presenters finish their presentations. Bathrooms are located in the main facility, which is outside and to the right. So if anybody needs to use the restroom, please help yourself to the main facility. There's light refreshments here, and I hope everybody gets to be very informed from this wonderful panel speakers that are going to present today. So with that, I'd like to introduce Dr. Luis Marcos to the microphone. Thank you.
Thank you very much for the introduction. The first thing I want to mention is that if you notice my accent, so I'm going to speak slowly, okay? So the first thing I just want to mention is that I was working in Stony Brook since 2015. There was not a Tick-Borne disease clinic or a Lyme clinic, whatever you want to call it. So I start, looking at these patients. By the way, I came to the United States thinking that I'm going to do research in tropical medicine, okay? But I didn't find any parasites in the US except Babesia. So that opened my mind to study vector-borne diseases, and the most common vector-borne disease in the United States is Lyme disease. So that's how I ended up here. So I was seeing patients with Lyme disease, and they were claiming to have long-term symptoms, which were real, right? So I was seeing most likely 200 patients, and then I said to this old professor of medicine at Stony Brook, I said, this is weird. All of them complain about the same thing, which are pains, headaches, fatigue, sleeping 12 hours a day. They cannot work after 3 p.m. because they are very fatigued. And these things these symptoms comes in cycles every 3 months, or 6 weeks, or change on the weather, or some stress, long trips. Another infection triggers these symptoms. And I said to him, I think this is very important to study. But there was some kind of gap on the research at Stony Brook for 10 or 15 years, I believe. I went to New York Medical College, and I talked to one of the most recognized Lyme doctors in the United States. He told me, you only have 5 seconds to talk to me because I'm very busy. So I told him, if he's kind of almost retired, right? So I told him, okay, if you were me, what would you do? And he said, look for the cause of post-treatment Lyme disease syndrome, or also called chronic Lyme. That's how you know that, right? Chronic Lyme. And so that's exactly what I did 5 years ago. I started building up a program at Stony Brook, and finally I got a Department of Defense grant to study post-treatment Lyme disease syndrome. And that's what I want to talk to you in the next 20 minutes. I thought it's going to be an hour to talk, but it took me 20 minutes, so I'm just going to focus on the most important things, okay? And if I can, yes. How can I advance this?
You got to point. I think you got to point it towards the laptop.
Oh.
Did you practice before or no?
No, I didn't practice before, but what about if somebody else clicks the next slide? Because this works, you see? But that really bottom doesn't work. No, somebody did. Yes, okay. Yes, perfect, it works. Okay. Okay, so there are a lot of outlines here. You know, the most important thing right now is to know about what ticks do we have, right? Then we're gonna talk about a little bit about the co-infections, and then finally the chronic symptoms, okay? I gave this lecture to a lot of places, so just stay with me a little bit about what is so important first to know the ticks, because the deer tick is the one that will transmit Lyme disease, whereas the other one, which is the long star tick, will not. And the most common one that you have here, actually, the long star tick came from Texas in the 1950s and invaded Long Island, and now the population is 70% long star tick, 30% deer tick. The last one, the dog tick, is not really that important. It's very infrequent to see it, and we only see 1 or 2 cases proven with Rocky Mount spotted fever per year in Long Island. So it's not very common. The most common one is the long star tick. That's the one that transmits the meat allergy, and that's the one that transmits ehrlichiosis. But most important is you need to have a microscope with you or magnifier to recognize the tick. Because if the tick is a long star tick, you are kind of good to go. If your magnifier recognizes the deer tick, which is the top one that, and is engorged, then you qualify most likely for prophylaxis with doxycycline, right? So that's it. That's the teaching point on that slide. Ticks are really tiny. That's a penny. That's the tick. This is really engorged tick for almost 5 days in a person. So you can imagine the ones that are really small, the nymphs, right? I don't have any conflict of interest, just so you know that. But after buying 25 microscopes in Amazon, I found that this one is perfect. It only costs $10. You attach to your smartphone, and you can see the tick beautifully there. And you can send a picture to somebody who knows ticks, or you can Google it. And if it's a long star tick, then you're good to go, right? If it's a deer tick, then you talk to your doctor. All right, enough about ticks, okay? We developed some, because you are eating oysters, right? So I developed some videos that you can go into the Stony Brook website and really educational about ticks, okay? All right. Now, we live in the epicenter of Lyme disease. Believe it or not, we are the second county in the whole country, after Pennsylvania, somewhere there, that we have the highest number of Lyme cases in the whole country. Yep, it's real. Because of that, what I did is just do some studies, and say how people with Lyme disease present to the hospital for the first time, and usually it's with the bullseye rash, the European migrants. But also, this is something that I believe we have not studied really well, and is the involvement of the nerves in Lyme disease, because there are some strains on Lyme that may not present with the bullseye rash, but can present just with numbness and tingling and headaches. And, I talked to several doctors at Stony Brook, and I said, I really think that sciatica pain that the patient has, or that pain that goes from the neck to the arm, nobody paid attention on that, and we did a Lyme test, and it was strongly positive, right? And we treat that, and the patient relieved the pain. So sometimes, I think that, I'm not gonna blame the doctors, but sometimes we don't listen in very much to the patients. And I think that perhaps that's why this kind of Lyme disease involvement of the nerve has been a little bit neglected or not really paying attention by us. Anyways, so blue spots, all this is Lyme, comes in May and June, as you know. Right now is the highest peak of cases because we have the nymphs outside, and the nymphs are the deer tick nymphs are the ones that will transmit Lyme disease. Only 5% of the tick bites from deer tick transmit Lyme disease, not 100%. That's number one. Number two, the nymph is the most common one that transmits Lyme. The adult usually does not transmit Lyme. Just there. So right now, if you go outside and you don't see ticks, it's because your eyes are not perfect. The ticks are there, the nymphs are there. We can see them, they're really tiny. Anyways, let's move on. That's a video that you can see the spirochete, the bacteria of Lyme disease is called Borrelia burgdorferi. and it moves like a snake. And that's exactly how it moves in your skin. And that's how the bullseye rash starts growing, because it's the inflammation caused by the bacteria in the skin. But I can't put the video. This is not really that important right now. I'm going to just pass this. Yeah, so Borrelia burgdorferi, right, is the cause of Lyme disease. It's a bacteria. It's a bacteria, and it's usually present in the upper east of the United States, and also in the Pacific, coast. But usually all the cases are here in the northeast. In the Midwest, there are not really many cases, except in Minnesota and Michigan. All right, I think this is one of the important things, is that the deer technique has to fit on you more than 24 hours, okay? Usually more than 24 hours to transmit Lyme, according to the mice studies. But, if you have it for 18 hours, it can transmit Lyme, sure, why not? The question is, who counts the minutes or the hours that you have the tick, right? So how do you know that, right? So how you know that is to look under the microscope, the size of the head and the size of the belly. If the belly is less than the head, then that tick didn't fit. If the belly is two sizes of the head, then that nymph tick really fed on you, right? So the belly has to be big. If that happens, then you have a tick bite, and if you develop a small rash on the tick bite, it's just an allergic reaction, like a mosquito bite, right? It itches, and that's it. That's not Lyme. 5 days later, usually 5 days at least, you will develop the bullseye rash, not right after the tick bite. I think that's important for everybody to know. Most of our cases that comes with neurological Lyme in the brain, or Lyme arthritis or Lyme carditis in the heart, they haven't seen any bullseye rash. They haven't, okay? So it's not like, if I get sick, go to the hospital and I said, oh, I have fevers, and the doctor asked me, do you have a tick bite? No one of these patients will recognize a tick bite, because it was a nymph. And the nymph, you can't see that, actually. You try. You have to do with a magnifier. It's really difficult. So most of our cases with Lyme disease, 90% or more, did not have a tick bite. Therefore, the question about did you have a tick bite is irrelevant in the hospital. It's basically the symptoms that we are looking for. This is the classic bullseye rash textbook, okay? But however, we don't see that from the patients. This is textbook. This is beautiful. This is a target lesion, and we have been taught, right, that this is a classic rash. But the real rashes that we see in practice are, it could be just a blister with a big round of redness. It could be just macules, like patches. And I have a patient that it was running fevers and sweats for 4 or 6 weeks with headaches. He had multiple rashes in his body, and somebody told him that he has some kind of allergy to leaves, ivory, something like that? Poison ivy, okay, thank you. So, okay, you're paying attention actually. Okay, so, and then somebody get a test for Lyme, and it was full blood positive. I mean, if you really have Lyme disease, honestly, the test is usually positive, almost all the time. At the initial infection, like you have 2 weeks of symptoms, that's true. Half of the test may be negative, that's true. But then we repeat it 3 weeks later to confirm the diagnosis, because in 90% of the cases, you will have a test positive for Lyme. Then after that, once you have a positive test, the antibodies will go down in years. And you can have every single year a positive test for Lyme, because you have antibodies. Now, I'm going to move fast because this is not really that important. This is a real case. And you can see the rashes in the patient with multiple rashes, real, it's a real life case, right? So it's not a classic bullseye rash, right? But that's a real case. And perhaps the light is affecting you to see this, but there is a rash there, and usually it starts growing, the rash. If the rash doesn't, I call it a rash, right? It doesn't grow. If it doesn't grow, stay there, and that's not Lyme. If it doesn't grow and itches a lot, an allergy perhaps. But that's perfect. But then, thank you. And then it grows usually more than 5 centimeters diameter. It has to grow. It can't be that small. No, it will grow because, as I told you, this bacteria, like a snake-like bacteria, under the skin start moving and forming, this redness, inflammation. So that's one of the keys. When I talk to patients, I ask them, describe the rash. The rash was growing. Take a picture of the rash every day. You will see, it will grow. This is the patient I'm talking about, that he finally went to 4 doctors in our county. He said, please test me for Lyme. And the patient has to beg the doctor to be tested for Lyme. And of course, the Lyme test was strongly positive because he was 6 weeks sick. So there's no way that the Lyme test will be negative. Yeah. And then you see this rash, like a half moon rash, that you see the double erythema, the rash here, the blanching area, and then the external circular. So it has been growing. So this is a real case, one of my patients. This is a very fainted rash, really small, that was under the thigh, and nobody did a physical exam on the patient. We did it, and we found this, and the patient had a fever of unknown origin, but we discovered the origin, that was Lyme. This is a patient also of mine that complained of shoulder pain in the back, but nobody saw his back. And so we saw the back, and we saw this small dot here, blanching area, and the target lesion, and the Lyme test was strongly positive. So, okay, now very quickly, not all these rashes that I show you are Lyme disease. It can also be something called STARI, like Star Wars, STARI, Southern Tick-Associated Rash Illness. And that's related to the long star tick. What's the cause of this? Nobody knows. But does not cause long-term symptoms. So, important is to know about the tick. It was a long star tick or a deer tick. This, we don't know, and we are doing a study actually to know about that etiology with NIH. And it's very, very, we think it may be just an allergic reaction, by the way. All right. So, in the COVID times, we have to do telemedicine, right? So I told the patient, show me the rash. Look at the rash in the back, huge, and all the back full, some huge migrants. So that's Lyme, right? It's huge. Okay, anyways, I just want to move forward. Okay. I want to move forward to something I want to show you. Okay, so the Lyme test at the beginning of infection, let's say that I got a tick bite a week ago, I show up with a bullseye rash, right? Okay, the test for Lyme will be negative in 70% of the cases. But if I repeat that Lyme test, it may be positive in 90% of the patients in 3 weeks from now, not today, right? So when patients present with headaches, nerve involvement of Lyme disease, pretty much all of them will have a Lyme test positive. It would be a lab error to have a Lyme test negative, just to let you know that part. I mean, that's what I have seen, right? But also, you may have symptoms, right? Lyme test negative, but you are wondering, so what is causing the symptoms, right? What is happening after a tick bite? Well, we have also another Borrelia called Borrelia miyamotoi, like Japanese name, Miyamotoi, discovered in 2005 in the United States. And that one can cause actually neurological symptoms and recurrent fevers. We have seen cases, we've published that actually from here, from Southampton. Actually, 2 cases came from the same block. I don't want to tell you the book. Serology. Okay, I told you already that. That's, this is TMI, too much information, not really that great. So this is what it looks a Lyme test positive, all right? It's very confusing. It took me 6 months to understand this better, honestly. So the thing is that you have 2 tests. 2 tests. That's what is called 2-tier testing, according to the CDC, okay? So why? Because one test could be positive, but the second test may be negative because it's a very broad spectrum test, right? So the specific one is the Western blot. That's the Western blot. And all these are not antigens or protein of the bacteria. These are your antibodies. This is your antibodies. There is no test to detect the bacteria of Lyme disease because the bacteria goes very quickly into the tissues. It's not in the bloodstream. And that's the problem. Otherwise, anybody can do develop a test. We can culture Borrelia. So we need to rely on this, on the antibodies. These are your antibodies, and why the CDC said 5 bands, also called bands or antibodies. Why 5 and not 4, right? It's just because 5 bands will detect 95% of the cases of Lyme, whereas 4 bands will detect 80%. And so they just said 5, right? It depends, right? But if I see a patient with a first test positive and the second shows 3 or 4 bands, that's Lyme. That's Lyme, right? I mean, and the classic, presentation. Anyways, so doxycycline is the drug of choice for Lyme disease in 90% of the cases. However, some patients do not. So this is a case that I saw and published. So I went to the ER and I saw a case that was taking amoxicillin for erythema migrans, the bullseye rash, but didn't improve. So the doctor gave her doxycycline, and with doxycycline, 10 days, the bullseye rash went away. Beautiful, right? Because doxycycline likes the skin. That's why when you take doxycycline, you can get burned if you go to the sunlight, right? So it's beautiful for the skin. But 10 days later, the patient develops a Bell's palsy. And come to the hospital, and my fellow, who was trained, Stony Brook, we have seen, Stony Brook actually developed all the clinical trials for Lyme disease, right? So I asked my fellow, why did she develop the Bell's palsy? Oh, it's because the natural course of the disease. I said, sure, that's why doxycycline, it should stop the natural course of the disease, right? But it didn't actually. So I said, that's weird. So doxycycline did not work in the nerve in that particular patient. And we demonstrated that the nerve was inflamed in the brain, MRI. So it's real, right? So doxycycline didn't work. Why it didn't work? I don't know. But is the drug of choice? Sure. But the patient usually will say, yes, in a week I feel great on doxycycline, perfect. But if he doesn't feel great, that means that it's not working for some reason. Absorption, may not work, I don't know. We switched to something called minocycline. The exposure went away in 3 days, beautiful. Because minocycline it goes more into the brain, more into the nerves, right? But we have some cases also that minocycline didn't work, right? We have a patient with a neck pain, radiculopathy, Lyme test positive, very full-blown positive, strongly positive, no question about it. I put the septic reaction or the Rocephin intravenous antibiotic, and the pain went away, right? And the patient was in 6 doctors or something like that. If the patient will have a negative test for Lyme always, forever, never a test positive, then that pain may not go away with Rocephin, with intravenous antibiotic, may not actually. Perhaps there is a hernia, or perhaps there is something else, but regardless, we do the full workup for the patient and we find a cause and we help the patient. That's the bottom line, right? If it's not Lyme, well, good news, but it could be something else. But at the end of the day, we need to help the patient. Anyways, so, all right. Very quickly, I'm not sure how many more minutes I have, but this is the latest studies on Lyme disease. Steroids doesn't really help Bell's palsy. We don't need the steroids for Bell's palsy with Lyme disease. One thing. The other thing is that the doxycycline prophylaxis after the deer tick bite is good, but it's not 100% effective. So the reduction, right, the reduced risk to develop Lyme disease after doxycycline prophylaxis, after a deer tick bite, reduces in 70% or 80% in chances, but not 100%, right? So those patients need to be followed up. In the next 4 weeks, did you develop any fevers, night sweats, headaches, something? If they say yes, then you test for Lyme. All right, so I'm gonna move this forward. So also they compare, and these studies were done, by the way, in Europe. because their Borrelia, the line, goes more into the brain than our line here. So they compared doxycycline and ceftriaxone, doxycycline by mouth, ceftriaxone through the vein, and they found for 4 weeks, ceftriaxone for 3 weeks, and they didn't find any difference on the results, on the symptoms. So 90% of them improved in each arm. So 10% actually did not improve after regardless what antibiotic. And that is something called post-treatment Lyme disease syndrome or chronic Lyme, right? That we know. Why it didn't work, nobody knows actually the answer for that. But I'm going to move forward to the hypothesis of that. It's something very similar to long-haul COVID, where you have infection and then you have these cycles of symptoms. But also we need to, demonstrate that you don't have a partially treated Lyme disease, meaning that you may need more antibiotics perhaps, or you have a co-infection like Borrelia miyamotoi, or you have, lupus or autoimmune disease or something, right? But I usually don't discourage the patient to think, oh, this is just chronic Lyme, you're going to have this forever. No, because some of these patients actually have sleeping problems, and the fatigue is pronounced during the daytime. And we fix the sleeping, and they feel better 60%, let's say, right? So, but it's an improvement. Well, anyways, so I just want to show you this is real. This is what I have seen along this last 7 or 8 years of being in Stony Brook, is that all these patients, after truly Lyme disease, right, infection, 20% of them continue having symptoms for 6 to 12 months. After 12 months, 10% of them continue having these cycles of symptoms. And the symptoms are usually this brain fogginess that they said, I can't pay attention. I mean, I'm there, but I'm not there. And they talk to me, but I don't, process what they're telling me. I can't think. And that happens for 3 or 4 weeks, and all of a sudden, boom, goes away, and again comes back in 3 months from now. Chronic pains, aches, stiffness of the neck, muscle spasm, really like debilitating symptoms, which are real symptoms. The question is, what is causing that? And even they have tried antibiotics for months, 3, 4 antibiotics for 6 months, 12 months, but the symptoms continue. So perhaps antibiotics may not be the answer, but we don't know the answer for that. But they improve, changing the diet, healthy lifestyle, good sleeping, that improve. But I believe that perhaps in the near future with the post-COVID syndrome, if we know the answer for that, perhaps we have an answer for chronic Lyme. Okay, so these studies have been done, that patients have received antibiotics through the vein. And through the vein are the best antibiotic, the rosettin, that's the best one. And regardless if they receive intravenous antibiotics followed by sugar, placebo, or other antibiotics, symptoms really does not improve that much. Yeah. So that's the problem. So I'm just gonna move forward because this is kind of the last slide or so. What's happening is that what we think is happening is that you have infection and you have antibodies, right? And those antibodies will kill the bacteria along with the antibiotics, fine. But those antibodies may cross-react with the nerves. It may go into your brain and may activate some receptors in the brain, and like cross-reaction antibodies, or also called auto-antibodies. So that antibodies are formed to kill the bacteria, but actually also they are affecting your own nerves and your brain. That's what I believe may be the answer. That's why we're doing the study, that if we find those antibodies, actually with Oklahoma Center and New York Medical College, if we find those antibodies, right, we recognize them, then we can create a monoclonal antibody to stop that. And so that's kind of the future. It's just hypothesis. I'm not telling you that's the answer, by the way. All right, well, that's the study that we're doing. A lot of research and and that's everything from my side. Thank you.
My main focus is to talk about how to keep the ticks away from you. Because the good news is if you're not getting tick bites, you're not getting any of these crazy infections. So we're going to start off, it is a Saturday afternoon, but we're going to start off with a quiz, right? So you can either raise your hand or yell it off. So here's our first quick question. Ticks only make you sick if they're attached for more than 24 hours?
True.
False, actually. We know things that alpha-gal and even the Powassan deer tick virus have really short transmission times. And Dr. Marcos was saying he's had people with ticks 18, 20 hours and seen them get ill also. Interesting. Here we go. Ticks only bite in the summer months? False. Also false. Correct. They'll bite all year long. How about this? Let's see who's listening to Dr. Marcos. Everyone with Lyme remembers the tick bite? False. Yes, false. How about this? Ticks only carry one germ at a time? False. Fantastic. You guys are good. How about this? In Suffolk County, chiggers are a pesky problem at the end of each summer.
Not really chiggers.
Not really chiggers. I like your style. Where do you find out what they really are? Nymphs. Yeah, they're nymphal lone stars. How about this? A turkey, guinea hen, or possum will eat 200 ticks a day.
Yeah.
Actually, look at this surprising data from Virginia, where they found that a possum will eat 5,500 larval ticks in a week. Turkeys, 200 or 300, and guinea hens, up to 500 a day. So even though they're super pesky, all those little guys running around, they eat ticks. Look at that. A possum will eat 5,500 larval ticks. And Dr. Marcos was just saying the larvae are those ones, you know, those little baby ones that grow into the nymph, and the nymphs are our really dangerous ones.
But do they carry more than they eat?
Do they carry more than they eat? That's a theory behind why there's so many lone stars, because they're on the turkeys. We've got some slides coming up on that. You guys are on fire today. I love this. Okay, so my main focus, and I'm like Dr. Marcos, I'm like, oh, I have an hour's worth of slides, right? But my main focus is to really talk about prevention. And the one thing to remember, Frank and everybody here at SOFO wants you to remember that prevention is a multi-layered approach. You have to protect your yard, you have to protect your clothing, you have to protect your skin, and you have to remain vigilant to really avoid where ticks are. If you miss one of those little cogs in the wheel, your chance of getting a tick on you is going to be much higher. So it's really this all-encompassing prevention approach, right? And we know that ticks can be found in very high or low temperature as long as the humidity actually is the same. Ticks like moisture, and they hate dryness. There's nothing better than a nice, dry, brown Hamptons front lawn, because there's no ticks on there. You know what I mean? And I'm really passionate about the 4-poster system, which we'll look at. And there was a recent article from Sag Harbor about how using a 4-poster system with deer feed greatly reduced the tick population. So a couple key things to remember is tick diseases are definitely on the rise. Tick diseases are definitely preventable. Ticks are really hard to kill. And we don't advise removing the tick with a lighter or with tape. Use our little forceps, our little tweezer, which all of us at the Tick Center tested multiple different versions. And we figured out that that's the best way to really get that tick. Another favorite thing I like is take duct tape. And after you push your pants and pull your socks up, put duct tape sticky side out. So when the ticks crawl up you, they get caught in the tape, the sticky side out. Use 2 layers of protection, like protect your skin and your clothing. And definitely, like we just heard, if you see a tick on you, get rid of it as soon as you can. Definitely don't let the tick stay on there. We saw this same slide from Dr. Marcos. We know that we're in peak tick biting season right now, right? We really have to be alert. Now this is really interesting, everybody. This is the geographic distribution of Lyme disease in 2011. But, okay, look at that picture. Now look now at 2019, how much that Lyme disease is spreading. And we think that a big reason behind that is related to temperature and climate change, as well as things like deforestation. As the suburbs are encroaching into the forest and the woods, people are moving to where the ticks are, and the deer and everybody has less place to go, for example. In fact, I always share this article because it's mind-blowing. We know from the Journal of Applied Ecology that the ticks have been slowly moving north. And every year, the warmer climate pushes Lyme disease 4 kilometers north into Canada. There are Canadian doctors publishing on Lyme disease, and their entire career, they've never seen Lyme until recently. So we know that northerly migration doesn't stop at the US border. It just keeps going up and up and up. 19 years of research show warmer climate that larvae and nymphs show up more, greater population, and they show up faster. Part of that is, as we said, the turkeys, the deer are moving the animals, and something I'm particularly interested in is the moose population. Now, a lot of us in college, after school, we would paint signs, save the whales, save the whales. We'd be protesting to save the whales. But a real epidemic nowadays is the destruction of the moose population because they have so many ticks on them. And in fact, just from last year, winter ticks killed out 90% of the moose calves in Maine. And even in upstate New York, we would have 20,000 wild moose. The last population count was around 550. Look at this article. The moose are literally being drained of their blood. It's about as disgusting as it gets from University of New Hampshire. You could have 10,000 on a moose, for example. So there's a big decline in moose population and all these ticks moving around them that way. So remember, ticks do bite all year round, and we know from Penn State entomology that ticks can be active as low as 28 degrees. And even though it's a nice spring day today, think about this tick coming out of the ice, right? After it's all engorged. So even in winter, we worry about ticks. This January was so mild, I had patients getting ticks as they were raking their lawns in January. Under that leaf pile where it gets warm, you see little tiny ticks. Even in January, they were hiding out there. So Dr. Marcos gave us a lesson on this already, but think about, what do ticks look like? We know that the newborn tick are those larvae, and they typically have 3 legs on each side for a total of 6. The nymph is the hungry teenager, right? When that grandson or granddaughter comes to your house and they eat everything in sight. That's like a nymphal tick. They're hungry, they're going after everything. And then you have the adults. When someone says, they have a larval tick, which is really hard to see, but those 6-legged ticks really don't have infection. It's the larvae, which are the aggressive feeders, that we're nervous about. So it definitely is tick season. We have the deer tick, which is what we worry about with Lyme. We have that lone star, the dog tick, and 2 new neighbors. We talk about the Asian longhorn tick. These are some of the newer species of ticks that we're seeing coming out. So when we talk about the lone star and the deer tick, look, here's the adult activity. Again, it's springtime, and we're really starting to see some lone star activity. And then those deer tick really start coming out, adults, right? We have teenage deer ticks now, and the adults are coming out later in the summer. And of course, the nymphs, right? The nymphs are what we think about when we think about these little, baby, like chigger-looking, like types of ticks that way. So we're really getting that out now. So that deer tick nymph, right? When we think about the deer tick nymph, it can carry Lyme disease, Babesia, Anaplasma, and these viruses that we talked about. The deer tick larvae are most active July, August, September. Those are those like small little chiggery type size ticks that we worry about. So again, the basic thing to remember is we're in a tick emergency right now, and it'll probably keep going till at least Halloween. Now, this was a neat article from the New York Times a couple weeks ago talking about the increase in other kinds of infection. we're seeing more and more babesia, more so than we're seeing reported cases of Lyme. Lyme is still the most common infection, but there are more of these other types of infections out there that we really need to think about. Remember the true-false question, ticks can carry more than one disease. So we've seen situations where someone has babesia and Lyme together, for example. And here's that article Dr. Marcos was talking about people when they have a Lyme disease, they don't always remember the tick that got them. And here's that deer tick female. Again, very active. Look, even in the January to February, really active that way. And then down in the fall, October, November, December. So remember, they can carry more than one infection. Here, if this doesn't make you lose your appetite, hopefully you ate before you see these slides, right? Here's the male deer tick feeding off of the female. And again, the male deer tick really doesn't transmit infection, right? So listen, when someone says, I have a little tiny tick, they're clear, they have 3 legs on each side, I'm like, don't worry about it. That little larva doesn't really have infection. When we talk about what a nymphal tick looks like, those are the ones that are the most aggressive feeders where we really worry about infection that way. And guess what? I haven't seen it in a year or two, but I think there are still some dog ticks out here, right? You've seen some? Some people have seen some dog ticks, right? And again, they do not need Lyme, and you don't prophylax a dog tick, for example. So here's that dog tick female. So here's the conversation, right? A patient calls me, I have a tick bite. And then I tell them, can you bring the tick in? I want to know the type of tick, if it's a larva, a nymph, an adult. So don't squish the tick, don't burn it, don't flush it down the toilet. Save it or take a picture of it with your phone, because if we know the type of tick, we'll know what kind of symptoms to look out for, and we'll know if you may or may not need prophylaxis, for example. Right? So definitely it's super tick season. Here's a patient sending me a picture of what all those little Lone Star nymphs look like, just completely. And this was just one of her toes. She had probably 60 to 80 ticks she had to pull off. So now, just an interesting point. If you do get that Lone Star tick, right? And this is just a theory. Is the Lone Star tick gives you that alpha-gal meat allergy. Anybody heard, know anybody, or anybody have it? Or, wow, yeah, look at those hands. Everybody. So it's my own personal theory. I haven't really published it, but I tell people, if you have a Lone Star tick, don't eat meat for a month. Maybe if you don't give that allergy a trigger, it won't activate. So I'm keeping a rough list. It's worked about 60-70% of the time. People are miserable missing all of those July barbecues, but it's better than alpha-gal. You know what I mean? Got it. Great. Now, we have some new visitors, right? New infections, something called Heartland virus, which is also transmitted from that Lone Star tick. And this has been tracked now by the Suffolk Department of Health. So we have Ehrlichia, Babesia, Anaplasma, the Lyme, the alpha-gal, the virus, we have this Heartland virus. So again, there's more than one infection. And another new member, right, is what's called the Asian longhorn tick, which is a new tick that we first found around 2018. People, this tick has what we call asexual reproduction. She just reproduces without a mate, like thousands of ticks at one time. That's scary, actually, if you think about it. And the Gulf Coast tick. So hopefully, if Frank sees 2 new members applying for SOFO membership, the Asian Longhorn and the Gulf Coast, hopefully those are actually 2 members that he'll deny membership to. The rest of you better renew your membership before you leave today. That's another story, right? Okay, but my real job is, how to make sure you don't get Lyme. So how do ticks get infected? Ticks get infected by biting and feeding on an animal that has Lyme, right? And that's how the tick will then get the germ. And that tick carries the germ and then passes it on to other animals. So reducing that deer exposure definitely is Critical, that's huge. Okay, great. And then of course they pass that germ on to people and pets. How many people have dogs with Lyme disease out there? Yeah, right, they go on doxycycline too. So look at this, everybody sees this map, and this is a 2-year cycle. So the mom lays the egg, could lay thousands of eggs, and it then grows into this larvae. And the larvae will eat its first meal from a mouse, a bird, or a chipmunk. People, this is the most empowering thing you can think of. If you can reduce the mouse, the chipmunk, the squirrel population in your yard, you're going to greatly reduce the chance that that larva is going to grow into one of those feeding nymphs. I know people hate it, but I'm going to say it. Go home tonight, get rid of your bird bath. Go home tonight, get rid of your bird feeder. That's going to greatly reduce the amount of ticks dropping in your yard. All of that bird food falling into your yard attracts the mice and attracts chipmunks and squirrels, which brings more ticks into your yard. In fact, they've done a study where they found dead birds in Central Park, and they have 30, 40, 50 ticks on them. Because people are like, how can I get Lyme disease in Central Park? Like, well, we know that birds that travel through there drop ticks when they stop there. So get rid of your bird bath, your bird feeder, all of that kind of stuff, right? And then the larvae molt over the fall and the winter. And then as nymphs, these are those hungry teenage nymphs, right? The deer tick nymph is the Lyme, the Lone Star is the alpha gal, and this is where they will feed off of you, right? A mouse, a person, a dog, something along those lines. And then they will eventually molt into adults. So, I really focus a lot on reducing this population. Another really cool thing is an owl box, right? If you attract owls to your yard, those owls eat the mice and the bird and the chipmunks that are moving the bad ticks around your yard, right? So remember, what's the key to prevention? Use a multi-level approach. Number one, just be situationally aware. Avoid the tall grasses, stay in the middle of the path. Maybe go to the beach in the summer and go do your trail hiking in less risky times, for example. Take care of your yard and your lawn, protect your skin, your clothing, and then through the community. So, as we said, get rid of mice and birds. Look at the number of ticks on this bird, for example. Bird bath, bird feeder. If you're using a compost pile, use those free pallets and get it up off the ground. Because compost a pile on your yard attracts a lot of mice and ticks, right? Leaf piles. And even using deer tick bait boxes, which are little permethrin impregnated bait boxes that the mice run through, also greatly reduce your tick population. Keep your grass really short. Let it dry out, people. There's nothing cooler than a brown Hamptons lawn. You save water, you save mowing, you reduce your ticks. Your grandkids and kids can roll around on a brown lawn. A lush, wet lawn attracts ticks for sure. Using a lot of 3-foot wood chip borders around your desk, around playground equipment reduces that. And again, remember, ticks die when they're dry, which is why coming in from outside, we always say put your clothes in the dryer, not the washer, because you want that dryness to kill the ticks. And consider having your yard sprayed. We've got info on that in the back. Here's just an example of that mouse. You can just barely see how covered they are with ticks, this particular mouse right here. So reduce the mouse, the chipmunk, the squirrel, things like that. So here's that classic yard. You got a nice 3-foot wood chip border protecting your whole area. You've got deer-resistant flower gardens. So you really want that nice zone. You've got short, hopefully brown grass, not really attracting a lot of ticks that way. So remember, a brown lawn is okay. Your bird bath and bird feeder are bad. Your wet grass attracts more ticks. And then how do we defend ourselves? When you go out in the world, you want to defend your skin and then defend your clothing as well. So clothing, always tuck your socks into your pants. Maybe use that duct tape, the sticky side out. Shoes should also be treated. And one of my favorite things, this has been working for years, I tell people to travel with a lint roller. And if you're working in the yard, out in the grass, or you're hiking, every once in a while, roll this up and down around your leg. If there's any loose ticks crawling up, you'll see that you'll capture them on your lint roller.
Also on your pet.
Yes, these are great if you have got a long-haired pet. Yeah, hold it, and a lot of them look forward to getting rubbed with this when they come in. They roll on their back, they put their legs out, and they're ready for their lint roller treatment. Really interesting. So, and make sure you have one of our tick kits with you for sure.
Can I bring up one? I noticed that's permethrin up there.
Yes.
And although I haven't experienced it, I know that it's deadly on cats.
And butterflies. That's an example of permethrin here, right? So some people will spray their yards with permethrin, and there are cedar oils, there are natural alternatives. I'll normally tell people a good chemical treatment in the spring to kill the nymphs, and then you can go natural all year, and that really reduces the bad guys in your environment that way.
So if you spray that on your clothes and it's still wet, it will kill a cat.
It will. Okay, so look out. Permethrin and cats is no good. So these are some of those basic methods, right? So there's that guy, right? Probably getting ready for a night on the town in Sag Harbor, tucking his pants into his socks. And here's just an example of that sticky tape. All of the ticks, look at the ticks that have been caught on there, right? And use repellents for sure, absolutely. Now, on your skin, a really cool tip is ticks hate the scent of lavender, which is why you go to the variety store, there's never any lavender soap or shampoo, it all gets sold out, right? So soap, shampoo, dryer sheets, body lotion, lavender spray, right? And I even put lavender dryer sheets in my kids' pockets. Definitely use DEET on the skin, especially if you're doing a high-risk activity. And permethrin on your clothing and shoes will definitely kill ticks. There's videos of a pair of pants with permethrin. The tick is crawling up it, and it just curls up and dies. So, using a more natural thing, or DEET on your skin, permethrin on your clothing, is a really good defense mechanism that way. The Environmental Working Group is definitely a great group that has reviewed a lot of different types of repellents, and they found that picartin and DEET, and even one of my favorites, oil of lemon eucalyptus, has a long protection time against bug bites. Picartin, like this red bottle here, and a lower concentration of DEET has a shorter protection. And a really good study out of Arizona, and this was specifically for mosquitoes, but it has a good overlap with ticks as well, found that after 4 hours, that oil of lemon eucalyptus was actually better than DEET. So one of the things I tell people is use oil of lemon eucalyptus on your skin, and then use a picartin or a permethrin on your clothing. Those are 2 layers that will really keep the ticks off of you. And that's in our guidebook that you could pick up. When you're out, stay away from the tall grass, walk in the center of your trail, wear white, light-colored pants with sticky tape, have your lint roller with you. And remember, ticks don't have wings, they don't fly, they're not in branches falling down unless they fall off of a bird, but they hang on a blade of grass and they wait for you to brush up against them. We do know that the Lone Star tick can sense your carbon dioxide, and you'll see it on a deck, like kind of come after you. But the deer ticks and the dog ticks are pretty lazy. They hang out on a blade of grass, hoping you're just going to walk past, and they're going to get swept up with you. After your activity, remove all your clothing. Make sure you put them in the dryer first. Do a tick check. Look for ticks, but also use the back of your hand and feel your skin for any bumps. You might feel a bump before you see it, for example. Shower as soon as you are done with your activity. Put your clothes in the dryer, wash to make sure you get any of those loose things off, And the Stony Brook Southampton Tick Center is famous for this relationship tip. If you're out at a bar, it's a summer night, like you're single and looking, like, oh, you know, I was at SOFO, and they said I should do a really thorough tick check after I've been outside. So I need to go home and have all my clothes taken off. It's actually about a few good dates with that tip. Use that the next time you're like at the Red Bar. You know what I mean? And then the last thing, so people, defend your yard, defend your skin, defend your clothing. And then we said we like the 4-poster system, you know, is remarkable, for example. You know, mitigating the deer population. And, you know, again, support the Tick Center. There's vaccine research. We'll answer probably during the Q&A. Here's an interesting research going on about the potential for maternal fetal transmission. There's occasionally a case that might be connected. That's interesting research that's out there. So remember, renew your SOFO membership, support the tick kit. We buy all of those tick kits. They're like $10 or $11. So anything you can do to help us get more for the next group, we always appreciate it. And then just a last plug, through Stony Brook University, I'm doing a study on people with chronic Lyme, post-treatment Lyme, who have persistent levels of fatigue, where we're looking at their sub-maximal aerobic capacity and how it correlates with their fatigue symptoms. So if anybody out there has ever had Lyme and you feel tired, come find me before the end of the day, because we are doing a research subject all about you. And again, we'll have a little Q&A at the end as well. So, great. All right, thanks everybody.
So my talk is food is medicine for Lyme disease. I do have a typo. It's not supposed to be an apostrophe S, and I couldn't fix it before the presentation, so I just wanted to correct myself. And also my picture is the vegetable night that's going to help fight infection, and I wanted to really put that out there to show you that there's a lot of things that you can do to take care of yourself when you have Lyme. So nutrition is an important part of your treatment program, empowers you to take charge of your health. I've been a dietitian for about 35 years. I always like people to have something that they can do to empower themselves, because I feel like our doctors tell us what to take, what to do, how much sleep you need. But I really feel like this is something that you can do. So what helps you? What can I do to heal myself? And what can I do that I shouldn't be doing that can harm me? So what we're talking about is inflammation. So basically the inflammation is what happens when we get bit by a tick. We sprain our ankle, our body rushes to heal, and it sends out all our helper cells, all our cytokines to try and help heal. So the area gets painful, red, infection, and this causes cell damage. The body sends out proteins, hormones, and chemicals to heal itself. I am of Greek descent, so I love this slide because it's a nice Parthenon, I guess. When we look at inflammation, it causes heat, redness, swelling, pain, and loss of function. So an acute inflammation is going to be 7 to 10 days. A chronic inflammation can be weeks, months, years. So what we're trying to do is we're trying to quell that persistent low-grade inflammation. And hopefully there's certain things that you can do. Unfortunately, most of our chronic illnesses are related to inflammation. So when we look at the bacteria that causes Lyme, we look at how it sabotages our immune system. It redirects your body's immune response to create a damaging inflammatory cascade, which is very detrimental. And this chronic Lyme can cause pain and discomfort, joint pain, swelling, cognitive decline, fatigue, mood changes, brain fog, and headaches. And the concerning part about this is we don't want to take anything in our body, like food, that could cause this inflammation or really get in the way of the inflammation. So you want to make sure what we're talking about in terms of our diet is an anti-inflammatory diet. So nutrition and inflammation is very near and dear to my heart. I love to talk about nutrition and food because I feel like we really can have some positive effects. Research indicates that nutrition has a profound effect on the inflammatory status of the body. In other words, the food we eat can either exacerbate or inhibit inflammation. Healthy foods provide this vibrant raw materials to produce strong immune cells and strong muscle fibers. And you need to give your body the tools to heal itself. Remove the obstacles that prevent healing. So when we look at gastrointestinal problems that are related from Lyme disease, sometimes it's from the antibiotics or medication we're treating, causing irritation in the GI tract, nausea, antibiotic-related diarrhea. There's also these co-infections that go along riding on inside of the tick, or also because of our immune system being weak in our GI tract, sometimes we pick up co-infections or complications from just having a weakened immune system. So there's destruction of the normal gut flora, which is our microbiome. So if anyone doesn't know what the microbiome is, it's all that good bacteria that live among us. Our microbiome actually starts when we're in our mom, and as we pass through the vaginal canal, we pick up some commensurate bacteria. As we get breastfed, we pick up immunity. If you're not breastfed and if you're not vaginal birth, you get it from being in the care of your mom who's kissing you. Maybe you have siblings, maybe you have a dog. As long as you don't have a sterile, complete, my mom is a Lysol freak environment, you kind of get this good bacteria, and it develops in that 1 to 3 years of age. And then as we age and as we grow, our microbiome gets built up. It's usually very similar to our family's microbiome. When we have an issue with antibiotics or children with ear infections, this is a challenge to our microbiome. It wipes out our good bacteria. So usually when I work with someone with nutrition, I try and find out the basics. Were you vaginal birth? Were you breastfed? Did you have ear infections growing up? And then as adults, we look at, do you have situations where you are constantly on antibiotics? Are you sick a few times a year? Do you go on antibiotics? Because what this does is it really wipes out the microbiome. There's so much research nowadays on microbiome and a lot of different diseases, so it's very important to understand what's happening in your body, and it's very important to understand even just the difference between a marathon runner and an obese sedentary person. There's just different bacteria. So you want to make sure you're populating your microbiome. So what we're going to talk about today is building your immunity in your kitchen. So high levels of the nutritious food, create healthy immune cells, which will go into battle for you. And I love this slide, like I said, because it's a colorful bunch of vegetables and fruits, and mostly vegetables, and that's really what I want you to get out of this. The whole thing is the vegetables are really the thing that we need to support. So we're going to look and talk about an anti-inflammation diet to combat that inflammation from that tick bite causing the Lyme, and that what we're going to talk about is just how do we get an anti-inflammatory diet, choosing whole, less processed foods, high quality protein, amino acids make up the building blocks for every cell in the body, fresh vegetables, especially leafy greens, fresh seeds, nuts, legumes, and key antioxidants, vitamins A, C, E, zinc, and selenium. So when we look at antioxidants, these are the colorful messengers. When we think of a plant and we think of nutrition, a plant cannot move, so it has to create or secrete chemicals to kind of combat the invaders or combat the mice or anyone's eating, so they have sometimes very sharp, bitter flavors. So our favorites like kale, the brassica vegetables, those are very bitter, and the bitter greens, and they're really great for us because just the way that it protects the plant, it protects our body. And when we look at something like biting into a piece of broccoli, we activate something called sulforaphane. Sulforaphane activates our liver, and our liver helps detoxify and cleanse our body as well. So it's very important to remember not necessarily these antioxidants, but remember the colors. Okay? And the reason why the colors are so important is because you're a person that, oh my gosh, I love a tossed salad with tomato and cucumber, and you eat that every day, you're not getting the benefits of the other colors, and that's what's so important. So what do antioxidants do? Right here. So antioxidants attack these free radicals. Oxidative stress is when our body ages, when our bodies develop cancer, when our bodies develop wrinkles. And what we want to try and do is we want to quell or turn off that inflammation and also stop the oxidation process from happening. And that's what the antioxidants do. They capture up the free radicals and they quell them and break them down and they get them out of the body. Okay, so this is really interesting. This is something that I've been very aware of. as I said, because I've been a dietitian for a while, but the grocery store, this is really cool. It says 50 years ago, the supermarkets contained between 600 and 800 foods to choose from. Today, the average supermarket stocks around 30,000 products with entire aisles dedicated to highly processed, refined, and sugar-laden foods. So one of the concepts we really talk about is walking the perimeter of the grocery store and not even going in between the shelves and trying to avoid or not have to deal with the last-minute grab-and-go kind of gum and candy and stuff and sodas at the register as well. And we also look, I'm very a big proponent of local vegetables. We're very lucky to have so many local organic farms that are in the process right now of getting their membership for the community-supported agriculture. So that's something I love people to think about, trying to just visit the farmers markets, the vegetable stands, be involved in the CSA, so then I know you're getting a bunch of colorful vegetables. We have a farmer that's on our side to get the vegetables to us and to kind of really do a good job in getting different colors and varieties. And very seasonal and local is amazing, and the amount of vegetables stands and things we have out here is just so exciting. More exciting than the colors and fake colors of the grocery store. So when we look at what is inflammation and anti-inflammation diet, we're looking at whole unprocessed foods. So we look at this side and we're saying this is an anti-inflammation diet. So we're looking at nuts, seeds, colorful vegetables, healthy fats, all the colors of the rainbow kind of thing, and really looking at healthy spices that reduce inflammation as well. And then we look into the grocery store and we look at all our processed foods, and we're looking at what happens when we get something processed is we take it and we chemically make it up and make it something that's detrimental or harder for our body to recognize. So think of a regular chicken breast I might grill on the barbecue as opposed to a chicken cutlet. So a chicken cutlet might have additives, preservatives, things like that in it that causes the inflammation because the body doesn't recognize it. So you want as much as possible to be on this anti-inflammation side, the whole foods. People always ask about gluten and dairy, and we're going to talk about, and even just the different oils that are these processed oils or oils that are made up in the body. Sometimes these are very inflammatory as well as the fried foods, any conventionally raised meat and dairy, and really just any sodas or the chemical colors of the fast foods. So the diet should be more on this side of the playing field. So what is an anti-inflammatory diet? I love how it has the happy avocado right in the middle. It's healthy fruits and vegetables, herbs and spices, fatty fish like salmon and tuna. I actually would say I like halibut a little better than tuna unless you have the mercury-free Pacific brand of tuna that we can get in the stores. Olive and olive oil and dark chocolate because it's actually bitter if it's made from the cacao. And everything on the other side is the processed type of foods. Okay. So what's the deal with gluten and Lyme disease? So gluten is one of our top inflammatory foods in our food system. It's a high degree of inflammation in the body with disease, and avoidance often removes a source of immune activation. So what's going on in your body is if you have the inflammation from the Lyme disease and if you have that inflammation going on, you want to try and minimize inflammation from other sources. And what I like to think about it is it's the same thing as what we call the theory of total load. Have anyone ever heard of that theory? So the theory of total load is my body is under so much stress, I don't want to put anything else in it to kind of make it activated or responsible for this inflammation. So gluten is one of the things that was really shown to be very inflammatory to the body. And what happens is people might experience immediate response, gluten including gas, bloating, diarrhea, constipation, heartburn, or abdominal pain, or even just a response a day or two later. But what the whole point is to try and get this inflammation down, because we don't want any gluten causing any kind of inflammation, joint pain, depression, irritability. Some people experience brain fog, some people experience headaches, rashes, and hormonal imbalances. So some people say, is gluten necessary? Do I need to avoid gluten? Because it's so much part of people's lives. They like to have a bagel for breakfast, they might have a sandwich for lunch, they might have pasta for dinner, or even just that bread basket out of a restaurant. And why it's so important is kind of, if this causes inflammation, I would rather have you say, I'm going to suggest this, but I'd rather have you try it out on yourself. go gluten-free. We like to say for about 60 days, and I'm going to talk about dairy as well. So when we say gluten and dairy, we like to say avoid it for 30 to 60 days, see how you feel, see if you feel any better, see if there's any reduction in your brain fog or your joints and aches and everything, and see what happens, and then you can kind of say making a better decision, because it's really based on you and how your body is reacting. Okay, so this is showing a gluten-free diet, and what I want you to think of when you think of a gluten-free diet is not as where can I get gluten-free pretzels or what's the best gluten-free cookie, but I want you to think of what are the foods that you need to eat. And it's the same foods, that anti-inflammation diet. It's trying to get healthy vegetables, lean proteins, good sources of protein, good sources of whole grains other than like a pasta or a couscous, but trying to get in those foods, worrying less about the gluten-free cookie and more about just that healthy eating. And that's really the stability of what we're looking for in our diet. And the other thing to think about, I know this picture has dairy in it right here, but the concern about dairy is the protein in dairy can actually mimic the protein in gluten to our body, and this also creates inflammation. So your body says, wow, this is gluten, it might not be gluten, it's dairy, but it's still causing that inflammation cascade. When we look at dairy and Lyme disease, it's also important to eliminate it or reduce the diet of the dairy. People can also experience these reactions from lactose, which is milk sugar, and sometimes even patients know that already, because sometimes it's very common that people say, when I eat ice cream I get bloated, I have diarrhea, I'm uncomfortable. So it's kind of something that we talk about a little bit more. Some people react more to the lactose or the milk sugar than the milk protein, so some people might be able to do a whey type of smoothie or a whey protein powder, but I still like you to try and get rid of it all and see how you feel. So you give me the answer. Does it make me feel better? Does it make me feel less achy? When I wake up, do I have less joint pain and discomfort? So dairy alternatives, there is so much gluten. There's been a plethora of gluten products on the market. There's been a plethora of milk products on the market. So there's a lot out there now because there's so many people that are interested in changing these habits and understanding that this is something that's beneficial for you. So there's great yogurts that's made out of cashew. There's coconut yogurt. There's soy yogurts. There's different kinds of milk. The thing I want you to be most concerned about if you're choosing alternatives is look for something that does not have added sugar. Because sugar is going to be my next slide, is the next bad guy that we're trying to make some changes in. So there's great products out there. Just look for unsweetened brands. I'm a big latte lover, and I've been trying to figure out which is the best milk for me. And one of the things I've noticed is that a lot of these milks might contain oils, might contain gums, might contain fillers, and they might contain even thickening agents. So you have to really know your products. There's some great products out there, whether you go to Provisions, whether you go to Wild by Nature, whether you take a trip up to Trader Joe's or Whole Foods, these are things that you can look for and test them out and see how you feel if you avoid it. The next thing is sugar, and sugar is probably one of the biggest inflammatory components for all chronic diseases, but most especially for Lyme disease. So even if we want to start small and you want to try and get rid of sugar, that would be the best bet that I think of. So sugar suppresses our immune system. The bacteria that carries Lyme, the spirochetes, feed off of sugar. Not only does sugar fuel the growth of yeast in the body as well, but it also supports growth of the spirochete bacteria that causes Lyme and Barilla burgdorferi. When there is a lot of sugar in the diet, the spirochetes become stronger and have more long-term effects on the body. Avoiding sugar substitutes, as they're highly processed and cause inflammation as well. There is some information that says stevia is the be-all, end-all in killing Lyme. There's no definitive research on this, so I don't want you to take that and run with it and take all your sweeteners and use a lot of stevia. It's okay to use a small amount if you need a little bit of that sweetness, and the sweetness goes a long way, but you really shouldn't depend on it to treat any kind of condition, and I'm sure the experts would agree with me on that. So why is sugar so important? Because it's become so big part of our lives. We might put it in our morning coffee or lattes or tea. We might drink a lot of sugar and a lot of calories from sugar in our sweet teas, our sodas, our juice, and even our evening cocktails. It's in our condiments, our sauces, our salad dressings, our tomato sauce. And even that sweet treat, if you're working and you bring some leftover Easter candy to the office so everybody else can eat it instead of you, sometimes people have regular coffee breaks and there's donuts around. People bring donuts to get excited to celebrate, or birthday cakes. These are all evidence of sugar and creeping into our lives. Some people are really big in dessert at night. What is dessert? Ice cream, chocolate, pastries, cakes, cookies. So those are things we have to think about. And the important part about sugar is it's so inflammatory that this is on my top list of things to do to help yourself, is to avoid sugar as much as possible. So sugar is so present in our diet and in our lifestyles. It comes in so many different names. And even though honey is a natural form of sugar, or pure maple syrup, it's still not going to be the answer we want, because it's still going to cause that inflammatory cascade in our body. So when we look for some nutrition tips for Lyme disease, we look for limiting items. If you're going to find something with a food label, you're going to look for something with less than 5 grams of sugar. And one of the other things I'd like you to think about is, what do you eat for breakfast? If you eat for breakfast anything like a bagel, anything like coffee with sugar in it, anything like a waffle or a pastry or a pancake, and you put sugar on it, if you eat anything like a carb and no protein, you might want to have a carb snack another 2 hours later. And you might get really hangry if you skip meals and then you just start at lunch. And what do we look for when we're hangry and hungry? We kind of look for sugar to solve our problem. Or if we have a great salad for lunch and we're looking for an afternoon kind of snack, we might grab towards one of those pastries that somebody brought in from work. Okay? So what I want you to do is, I want you to challenge yourself even just to start out with a savory breakfast. Get rid of the bread, get rid of the oatmeal, just try and have an egg omelet with some vegetables in it. Try that out, see how you feel, see if you're craving sugar as much as possible. And when we skip meals and we don't feed ourselves regularly, like every 3 hours, we kind of plummet, and then what do? We grab for something that we think is going to make us feel better. So really analyzing your own diet and what you do is very helpful in trying to make some changes and positively feel better. So increase the healthy bitters is the other thing we talk about. And it's funny, so I'm a dietitian, I have a lot of jewelry, I have blueberries on today, but I had the radish on this morning, and I'm like, should I have the radish or should I have the blueberries? Well, the blueberries are antioxidants, and I love those for chemicals for the body, but I really should have worn the radish, because the radish is a bitter. And the more you crave sugar and you try and get rid of sugar, the more if you increase your bitters, like your arugula salad, like the different greens, like the extra broccoli, extra cauliflower, even just the great radishes that are coming. I'm very excited about radishes because they're very bitter. Instead of having a bowl of candy at your desk, maybe even having a bowl of radishes at your desk, because you want the bitters to take over your taste and quell your sweets and your sweet intake. There's great watermelon radish. Has anyone tried watermelon radish? No. It was my favorite. Okay, the other thing we need to talk about is nightshades, because nightshades are a group of vegetables that have solanates in it. Nightshades contain alkaloids, which contain nitrogen, and these are peppers, white potatoes, eggplant, tomatoes, tomatillas, goji berries, okra, and ashwagandha. And also, when we look at nightshade, there's herbs and spices, the chili pepper, the paprika, the cayenne pepper, the red pepper, and the flakes. So one of the things that is problematic is nightshades are very inflammatory. So anyone with an inflammatory condition, like we're talking about with this Lyme disease, needs to take this as another test and say, if I can get rid of the nightshades and see how I feel. Because that sensitivity is going to get that same inflammatory pathway going, and it's going to be causing problems, intestinal issues, and digestion and upset. We don't notice these things because we love tomatoes, especially in August. And we don't notice them because we love tomato sauce, we love ketchup, red peppers. If you go to Mexican food, it is a big part of our life. So what I want you to do, again, think about it. And this way, you're thinking about it in a different way. Have one of the items, see how your body feels the next day. See if you feel any kind of joint issues. And it's funny because I did a CSA last year and it was all tomatoes. So I ate tomatoes all summer. I was so happy, and then I was like, God, I really feel achy. So, and I don't have any kind of Lyme disease or anything, but it's very common. I had a patient that swore by the anti-inflammation diet, and he said I would go out and I would eat French fries or white potatoes, and I would feel that achiness in my joints right away. So it's important to test your body and what's going on. We don't want anything to cascade and make your inflammation worse. Okay, so I also have a nutrition handout for you at the table. So this is a list of what to do if you're suffering from inflammation and removing the nightshades. There's great alternatives. The one I like the best, there's something called no-mato tomato sauce, which is not tomato sauce, but it's no-mato sauce. You can find in, I'm sure you can find it in Provisions. I'm sure you can find it, I think you have a King Cullen out here as well. No-mato sauce, or even just the Wild by Nature. So it's a sauce made of beets, pumpkin squashes, there are butternut squash sauces as well for pasta. If you're a big pasta person, of course you're going to have to do a gluten-free pasta. But what we're trying to do is we want to try and have you think out of the box. Oh yes, we do love these items because these are some of our favorites, but could you switch to sweet potatoes or turnips or pasta, or even make cauliflower mashed potatoes instead of potatoes, mashed potatoes? Can you make different changes and kind of just see how your body feels and see what's beneficial? Because remember, we're trying to get all the colors, so if you skip these, you still have plenty of colors and plenty of vegetables left to try. So try it out and see how it goes. Okay, so one of the things we want to also talk about is that microbiome. And again, I know this is a lot of information for you, so I do have a nutrition handout to try and get these colorful pictures in your kitchen, on your refrigerator, so they can be good reminders for you. So when we look at probiotics and we looked at microbiome that we all have in our body, and we said it's very similar to the body microbiome of our parents, one of the things people always think is, let me take a probiotic, and I'm not against taking a probiotic, but it's not always the answer, because when we look at the microbiome, we want to feed your own good bacteria as much as we want to, more than we want to introduce new bacteria. So a new bacteria of a pill is going to give us good bacteria, and there are different strains that we want to get, but we want to make sure we're just trying to populate our own as well. Sometimes, unfortunately, with these co-infections and these issues, people sometimes get candida overgrowth and the bad bugs taking over from that intense sugar intake as well. You're going to get a probiotic because you've had some antibiotics and you want to kind of help populate along with building your own. You want to try and get a good bacteria that has multiple strains. When we look at the prebiotics, and I'll give you some examples of this, when we look at the prebiotic, that's the food that gets lower into the intestines that's going to feed our good bugs. Okay, so this is just the difference. So the probiotics are the lactobacillus brand, so if anyone is a starter of sourdough making or makes their own sauerkraut, or I know there's a woman at the farmer's market that's out here that makes sauerkraut for our farm stand. That's more of that lactobacillus type of situation. Those will be in our fermented Asian foods, the natto, the kimchi, the miso. Those are great sources of those probiotics along with the probiotic pills. And the prebiotics are the good foods that feed the short-chain fatty acids that make the population in our colon and our intestines grow. So you want to try and do a little bit of both. When we look at one of the simplest things we can think about is cooling and heating rice, legumes, potatoes, even just the sweet potatoes, to create what we call resistant starch. So you cook it, you cool it, you reheat it, you eat it the next day, and those resistant starch is food that our lower intestine bacteria love and they thrive on. What you're trying to do is you're trying to build up your own defense with your own good bacteria. And if you have something going on with a yeast or a candida, I want you to be very, very cautious, because the probiotics, like the pickled vegetables, the sauerkraut, is really going to wreak more havoc on you than do good. The big thing out here, so I know somebody makes kombucha as well, so that is a plethora of this good bacteria, but if you have an issue with yeast, it's something I get really concerned about, because you'll get bloating, gas, discomfort, and it's going to give a great boost to your yeast, and it's not really going to help. And then on the other side, these are foods that we use hopefully in our diet, that we can kind of promote or support our good bacteria. So these are things like garlic alums, garlic, onions. This is chicory and chicory root. This is leafy greens. These are legumes. What we're trying to do is we're going to feed our good bacteria that, and they're going to populate and grow. This also helps regulating bowel movement if anyone is on more of the constipation spectrum than the diarrhea type of the spectrum. Is that like time up for me? No. Okay, just checking. Right, this is not picking up. Okay. One of the things we need to think about is avoiding the gut busters. Like Ghostbusters, you want to make sure you're not killing your own bacteria. What happens to our bacteria? We're very challenged with our bacteria if we are feeding it a lot of white bread, white flour, white sugar, soda, snacks, processed chips, cookies, crackers, the typical Western diet that we're trying to get you away from. If you're feeding that to our body, what happens is that typical Western diet loves to feed our bad bacteria. And we don't want to feed our bad bacteria, we want to feed our good bacteria. Excessive antibiotic use, unfortunately, sometimes in treatment of Lyme, we need to go on medications and antibiotics that do challenge our microbiome, so that's why we need to combat it with some good healthy things. And even stress, chemicals, pesticides, and antibiotic use is something that we also need to worry about because that really challenges our microbiome. Okay, so one of the things I like to look at is trying to get in these healthy anti-inflammatory fish and oils. So anyone with the problem with inflammation, we're trying to say, okay, let's take the inflammation down a notch. These oils from the fish, even once or twice a week. I do a lot of work with the Parkinson's patients at the hospital as well, and cardiac patients, so we are promoting for brain and brain health at least these fishes at least once or twice a week as well. Okay, so these are other ways to get omega-3 essential fatty acids in, and these are also healthy oils to try and get in. So fat was the bad guy. So like I said, I've been a dietitian for 35 years, actually. I got my degree in 1988. And when we looked at everything in terms of heart disease, fat was the bad guy. So they made these great snack bowls, cookies, and everybody was eating licorice and jelly beans and things that had no fat in them. We were having salads with vinegar and no oil. And what they found is that the fat was not as important as, the fat was a good guy instead of a bad guy. So we just need to choose the right types of fat. So these are our healthy fats. One of the other things I'm a real fan of is butter instead of processed margarine, fake margarines, because those oils are hydrogenated or fake to the body, and we want to make sure we have real things for the body. So I like this butter called Kerrygold butter. It actually has an amazing taste. My husband doesn't taste as well as I do, so he's just like, it's just butter. I'm like, have you tasted it? And he's like, it's just butter. I'm like, no, it's not. It's good butter. It's good also because it has something called glutathione in it. When the cows are raised in the pastures, instead of being grain-fed, they get good nutrition and they get buildup of glutathione. And that's really good for our liver because that's one of our most powerful antioxidants for our body. So these are great ways to get in the good, healthy fats that we're looking for to help reduce the inflammation in your body. So what are my Lyme nutrition tips? Eat small, balanced mini meals and snacks throughout the day. Some patients sometimes actually suffer from issues with hypoglycemia or sugar dropping and causing dizziness, so we don't want that to happen. I'm a big fan. I want you to think of protein, fat, and fiber. So key point to remember, anti-inflammation is one of the main focuses for Lyme disease and nutrition. Gluten and dairy promote inflammation and should be avoided. Omega-3 fatty acids, oils produce more anti-inflammatory compounds within the body. And foods that suppress the immune function need to be avoided. So probably in my list of things, this is the most important thing that we can do for ourselves. We really need to try and take the time to understand what our foods are, what our cravings are, what we're doing on a regular basis. Even taking your food and just doing a 3-day calorie counter, look at what we're doing. Make sure it's a day that you're working, or day, if you're not working, it's maybe a weekday and a weekend day to kind of see like what your habits are, what your trends are, and what you can do to make yourself feel better. One more slide. So while nutrition cannot cure Lyme disease, it can honestly help you feel better. I was talking with Dr. Marcos this before we got here, and he said he does notice patients that actually feel better when they take a healthy chance by changing their diet. So simple changes can support healthy immune function, boost energy, improve cognitive function, and alleviate chronic pain. It significantly can reduce your symptoms, reduce that inflammation that's going on, and accelerate the healing process. And being nutritionally healthy makes one feel good, and if that's a feeling that's not easy to come by for a Lyme patient. So I want you to take the extra steps to kind of think about it, do a little bit of self-analysis, and do a little bit of experimentation. I want you to see what it feels like to be gluten-free. I want you to see what it feels like to be dairy-free, and I also want you to see what it feels like to be sugar. You'll see immediate turnaround if you get rid of sugar in about a week. So it's definitely something that's worth doing because it definitely can help us promote health and feeling better in your body. So I think that's it. Thank you very much.
We developed a mission statement, and that mission statement was to educate the public and to also educate our doctors. And to that mission, we have had a number of medical symposiums for physicians on the East End. Our last one was last spring at Southampton College. We brought in experts from all over the Northeast. We had a woman from the NIH, we had a professor from Yale, we had people from Stony Brook, of course, and it was an excellent day. And so we're going to continue to do those symposiums. They're expensive to do, but we will continue on that path. We also have our helpline, which is run by Rebecca Young, and she has talked to as many as 900 people in one season, so that's a lot of conversations, but she has the patience of a saint. So if you have any questions at all, please don't hesitate to call her. I would like to thank Frank and Carol and Jane for inviting us here for the second or third season to put on this great program, and also to Dr. Marcos from Stony Brook, traveling out here, and Paula and Jerry. We thank you very much. This is another thing we have for you today. During 2020, when we weren't doing too much except staying home, we authored this handbook to tick disease, and Dr. Marcos has written chapters, and Jerry, and a number of our other advisors, and I think you'll find that this has just about everything you need to know. So please take one for your neighbor and other members of your family. We also have these handy-dandy tick removal kits, and we've been doing this pretty much since 2016, and we've given away thousands and thousands of these. All you have to do is ask. There's never a charge for them. There are forceps or extremely pointy tweezers in here, which are not child-friendly. That's for adults only. There's a magnifying glass, first aid supplies, and our tick ID card. So we'll have one of these for you at the conclusion of today's program. So thank you very much for supporting us. We are totally dependent on charitable gifts and donations to do our work. We're not subsidized by the hospital. So it's been a challenge for us for the last couple of years. After COVID hit, donations kind of dropped off. So we are existing right now with the help of one grant, and that has to be renewed yearly. So we're very hopeful that we'll be able to continue to do what we do. We also were gifted in 2019 with office space. It's at the Hampton Atrium in Hampton Bays. One of our benefactors actually bought the space, and he has given it to us for 10 years rent-free. But what happened was, as I said, our donations dropped off, and we haven't had the money that we need to run it. So hopefully we have some good partnerships that are coming down the pike, and we're going to be able to open that up very soon. There's also a Pfizer Lyme disease trial going on right now that Stony Brook is conducting, and we are participating in. We are the East End vaccine location. It's for children. There's also information on the table about that. If you have children in your life that you're interested in participating, there's a number on the back there, and you call. And we will be administering vaccines at the Hampton Bays Atrium location. It's by appointment only. So thank you very much again for inviting us, and now let's do the questions. If you would like to donate, we have a website, eastendtickresource.org. It's in this book, and there is a donate now red button there, and you just press that button, and a form comes up, and you just fill it out and send it to us, and we're very grateful for any kind of support that we can get.
I just have a question. Does everyone have business cards with them today so we can have them?
Yeah.
Fabulous. So maybe you can just, I'd like to get, I work with the museum, I'd like to have their cards, but.
And if you call Rebecca, she can filter out any questions or any, she does referrals, so
All right, thank you.
Rebecca is your source for that. Thank you very much.
Thank you.
So just by a show of hands, how many of you have questions? Okay, let's get going here.
Hi, thank you. How likely is it that one person gets a negative to the Brick-Dolphy test and they get a negative response?
Okay. Someone gets a negative response.
For example, I have my anti-nuclear antibodies of 1,280, and they keep testing me for one, and it's negative, and they test me for everything, and it's negative.
Just the ANA is positive.
Yeah, it went from
Right.
6
Yeah.
at 40 to 1,280.
Yeah. And so the line test is negative.
So after the vaccine, it doesn't. After the COVID vaccine, it doesn't.
Oh, well, the COVID vaccine, right, can trigger your antibodies, your immune system. Most people, will be okay, right? But some people can have adverse events, side effects. So, yeah, could be, right? Some people are predisposed to have inflammation after a vaccine, which is real. It's real. The same thing happens when you have an infection, and after that you have inflammation, right? However, people who have low immune system, right, like transplant patients or patients who get biologics like rituximab that freeze your lymphocytes, right? Those may not develop antibodies, right? So in each case we need to see why, right? If we have an explanation. If there's no explanation and if this is negative, then you can try another commercial lab, right? I don't have any conflict of interest. You have Quest, Sunrise, LabCorp, right? And if in all the labs are negative, the Lyme test, then there is no Lyme disease. But of course, you need to rule out other co-infections, right?
By rheumatologist.
Rheumatology, correct.
By rheumatologist.
Right, rheumatological diseases, that's correct. Yeah, I agree with that.
Thank you.
Sure.
Question here? She's next.
Yes, I do. Hi, I've had Lyme disease since '78, and first it was in my brain. I couldn't remember the names of my siblings or my parents. I was treated with amoxicillin and probenecid, and seemed to take care of it. And then later it was doxycycline. And now my doctor says I have lupus and MS. I said, no, I have Lyme disease. But every single night I wake up paralysis. I have to climb out of my bed to get my feet to open up. Very painful. And walk on the cold bathroom floor so I can get back into bed till it happens again. I've tried oil of oregano and many homeopathic things. I just wonder, I know it's for the rest of my life, and anybody that has Lyme disease says, I had Lyme disease. I said, no, you have Lyme disease for the rest of your life. I'm a pharmacy tech, and I see that the doctors are not helping these people. You say that Southampton, Stony Brook is now on board. I hope that they're training these residents to educate these people how to care for themselves. Because when I go to a doctor, they kind of like dismiss me. Just, here's 48 days of doxycycline and be careful in the sun, it's gonna tear your stomach up. But they're not really helping me. Thank you very much.
Can I just make an announcement before we proceed with more questions? I like to keep this generic, and personal medical conditions, I think we should not disclose here at this particular.
I think it can help other people.
I know,
to
but we could, these doctors are here to answer general questions. I think if you have an issue, you need to make an appointment and see a doctor at the
Correct,
hospital.
but some people don't know that it can be like a dementia.
Yeah, okay. I'm just making an announcement, so if we could just keep it to a general status, that would be very helpful.
Okay,
Okay,
sorry.
just to protect your privacy, that's all. I just don't want you to.
People don't know enough about Lyme disease. I just want them to know that these are the other symptoms.
Okay.
What you just said is very true. That they dismiss you, you know why? Because we don't know. That's the issue. And when I talked to senators, I went to Albany to do a hearing on Lyme disease. I prepared a 3 or 4 pages document. And I was talking to them, to the senators, and I said what you said, similar, because I brought the statements from my patients saying, you guys don't know. And I said, yeah, you're right, we don't know. And because of that, the senators actually gave me a small amount of funding, where 3 years ago, I was able to hire a research coordinator for that and enroll the patients and follow up them. But what I can tell you is that we all were born with genes, right? And some of them were awake, right? Like the color of our eyes and the hair, and yada, right? And some of them were not awake, were sleeping. And something, wake them up. Maybe an infection, maybe a trauma, PTSD, like 9/11, just watching that triggers something, right? It's real. So Lyme disease may have triggered those genes that you already have, right? And causing symptoms. And some people are predisposed to have long-term symptoms. Not 90% of them, 10% of the Lyme disease may have continuous symptoms. Very similar to post-COVID or long-haul COVID. Very similar. So it's not like you have the disease, the bacteria forever. The bacteria went away with amoxicillin and probenecid. But that infection triggered your genes. And then developing life, we develop in life hypertension, diabetes, right? MS or autoimmune diseases, usually it's triggered by an infection, actually. Yeah, and I appreciate that you said that because, like you, a lot of people have told me that we dismiss patients, and that's real. That's real. That's real. And we, once a doctor told me, I think that all the symptoms of that patient are in their mind, right? And I said, but it's real. It's real that we don't know how to treat. You go to a doctor and give you some antidepressants, right? And then you feel better, but the symptoms come back, and then we all try, right, for you to feel better. But perhaps we don't know the answer, and that's why.
Results so far?
They just started enrolling. What I was trying to say is that let's assume that they will have positive results, that the vaccine will be available in 2-3 years. If they have negative results, then it's square zero.
And just one other vaccine note, you still have to be worried about alpha-gal, babesia, Ehrlichia, so you still have to protect yourself from ticks, just as if whether you're vaccinated or not. So.
I had a question for,
Yeah, because the vaccine is for Lyme disease, not for the meat allergy, not for babesia, so you still just have to be as careful about ticks.
thank you.
I had a question for Mrs. Montagna. You talked about many inflammatory foods, and I was wondering, is there an index which tells you what the inflammation potential of different foods is? In other words, one food could be, on a scale from 1 to 100, could be 100 per gram, another could be 50 per gram. Is there an inflammation potential index?
Actually a great idea. I've never heard of that before, but I feel like anything that our body can't recognize as a food or a food item or a vitamin or a mineral, is more, less inflammatory than anything is processed. So you think of food labels with a whole bunch of ingredients. Broccoli is the only ingredient.
Yeah.
Chicken is the only ingredient, but anything that is chemically altered for any reason is something the body is not going to recognize. And when the body can't recognize it, it kind of sends out these messengers to kind of say, oh, hey, what's going on? And let me try and see what's going on. But I'm going to send out some antigens and some antibodies to try and quell the inflammation or attack the offender. And that's what happens. So it's kind of like anything that is foreign. Even so, eating fresh vegetables, whole proteins, any kind of food that doesn't have a label of ingredients is really how we judge it right now.
At the beginning, you emphasized identifying the tick to help identify the disease. And I'm looking at this chart, which specifies what tick carries a specific disease. Now, the ticks don't originate the disease, they just transmit it from an infected reservoir. And on that reservoir, deer or whatever, you can find any one of these ticks. So why can't a deer tick transmit a Lyme bacteria, and you know, why are they so specific to a specific tick?
I do. I've worked with some of the county entomologists like Scott Campbell and even American Society of Entomology. It's something with the tick's genome as to like what molecules it's able to carry and what would adapt to each individual type of tick. You know, so we definitely know that you know, Lyme disease is unique to the deer tick, but you know, alpha-gal is unique to the Lone Star. So it's really like that genetic makeup of each individual tick. And there's actually been a whole weekend conferences on exactly why with a Lone Star tick, you're not going to get Babesia from a Lone Star tick. So there's actually, that's a great question. I like your thinking. There's a lot of great data on that.
So it's not just a matter of
Now, is it a larval? Is it a nymph? Is it an adult? Has it fed or not? So definitely, I think, because you can't carry that book around with you, having this in your car, on your sun visor, in your pocket is really critical for us knowing what you might have been exposed to.
If somebody has had Lyme disease, they've been treated, they can get it again, correct?
Oh, yeah.
Assuming so. How would you diagnose it? Because wouldn't they just always be positive?
Yeah, you know, they always ask the same question, you know. It's very, very interesting because, you know, so what happens is that you develop antibodies, right? And very likely you will be kind of vaccinated for a year or 2 years, right? Okay, that's, yeah. If you have full-blown test for Lyme, like all the bands, strong, you know, like positive test, Lyme in the knee, you know, then you are vaccinated for 10 years with antibodies. If you don't develop a lot of antibodies and drop the next year, right, then you are susceptible for an infection. And that's how you can diagnose it, because you have a positive test now, right? Then in 2 years, you compare the new test with the previous one. If the test in 2 years, right, it goes down, then that's a new infection. It has to go up. So to have a new infection, because your immune system will develop new antibodies. So, but we have seen reinfections, and symptoms actually are worse in some of them.
They have testing apparently that tests different deeper bands, and they claim that it will show if you have Lyme, as opposed to going to like a quest lab, and they don't do as many bands of testing. Is that true?
Yeah, that's correct. What's happening is that, you know, your insurance will cover those commercial labs, right? Quest, LabCorp, and RISE. And there are other labs that the test is not FDA approved, actually, right? And those are in other places, not here, not around here, right? So they have their own criteria for the test to be positive for Lyme, their own unique criteria. But when we do the test in other labs, like West and RISE, LabCorp, you know, the test for Lyme is negative. But that particular lab brings us a positive test. But that lab has their own criteria. And that that criteria is not the CDC criteria, is not our criteria. And sometimes, they run a Western blot, and instead of saying that you need 5 bands, they say that you only need 1 band. Unfortunately, even with antibiotics, those patients, do not improve the symptoms because they never have actually Lyme disease, right? So, but you're right. There are 2 different kind of huge lab circles, right? And this is another lab here. But who you believe, right? So I believe in commercial labs. Whatever insurance covers, I believe on that.
They've done both lab studies and field studies that shows that if that larva has been fed, I believe it's in 10 to 12 weeks, then it's not going to grow up into the teenage tick.
Right, and the ticks live 2 years.
Yes.
Dr. Marcos, I know I've seen you, and there's great respect for all of you. I had 2 questions. One, speaking for people who are not on their lawns or on trails or who are in the woods every day because of your occupation, whether you're a landscaper or something like that, or ecologist like Frank and I, we take precautions, but it seems as though that it would be that group of people that should kind of be corralled to do the real tests on how Lyme and some of the other diseases progress, because we're exposed all the time. No matter what you do, I mean, when I go in the woods, I have, hip waders on, sprayed with Promethean, and I still, will get a tick bite. That's my first question. My second question is a Lyme PCR test better than the Western blot that'll actually show a active infection as opposed to one that you had previously?
You want to answer the first?
Sure. I mean, so like his slide said, we're the epicenter of Lyme disease. One of my most famous stories is waiting in line at CVS. And I had been in the hospital, walked through the concrete in my car, got my wife's prescription at CVS. The guy in front of me had a tick on him. So who knows if I'm brushing up against something in CVS and someone had a tick that actually dropped there. So definitely, we have to be hyper vigilant, even more vigilant if your occupation requires you to be out, in a risky area.
Right, but I don't think the instructions are getting out to the people. I mean, I am, certainly, and Frank is.
Right.
But to,
But that's why
the
we're
local
here
population that is in, doing their landscaping, and people are going, believe me, I see it every day.
Either in a single family yard or government. Remember in the old days, we used to spray for lawns and
Yes, all that.
all kinds of stuff, which had consequences.
Right.
Is there a relative value in?
Flybys and then
Yeah, they used to
spray
use
every
flybys. But definitely, I'll use my house as an example. When my kids were much younger, we would spray the yard, at least the perimeter. We'd see a noticeable reduction in number of ticks. But our neighbor, who we would often partner with, they're like, oh, I didn't pay for my spraying this month, and I think I'm seeing more ticks because they're avoiding our yard, for example. So definitely if you look in the handbook where we have a chart of what you can do around your yard, and definitely, like I said, there are lots of natural sprays like cedar oil, which is particularly effective. I generally do one permethrin spray to go after those nymphal ticks that we were talking about. But there's lots of stuff, like if you still have bird bath and bird feeder, get rid of those tonight. So.
Yeah, if you have any questions, what I get is callers that are anything from I've just been bit by a tick, what do I do? Or patients that are very angry, very scared, very upset. They say, I've been sick for 10 years, I've seen multiple doctors, what do I do? So we have developed this hotline, and you're welcome to call anytime. I'll talk to you or call you back, is usually how it works. The number is in here, 631-726 TICK. And I will try to help you out, work out what it is, maybe where you should go, maybe a referral, and hopefully give some of this information that they've all been talking about, increase your knowledge base, and yeah, feel free to call.
Thank you, everyone. So everybody who's attending today, thank you so much for attending. Everybody at home, thank you. And to our distinguished panel speakers, thank you so much for this very informative presentation. Thank you, everyone.